You work in a system or a hospital, you have got a super busy practice. You might want to have tools, natural solutions to help your patients beyond another prescription of pain medication. And that's what exactly we're going to be talking about. Two types of supplements that could be helpful for addressing osteoarthritis. And second reason is because patients are not looking for it. If you looked at the statistics and surveys, is that 7 out of 10 adults are taking supplements for their chronic conditions. I believe personally that it's probably more than that after COVID, because a lot of patients are much more self-aware. A lot of patients do not want more medications. Or you gave them medication, they came back and said, I've been taking this NSAID and it's causing me GI symptoms. The natural solutions very often comes with very minimal side effects, if any. The risk factor is much lower than prescription of medication. There's no risk of addiction, right? So there's multiple reasons why you would want to have in your tool belt, you would want to have a few options for nutritional or herbal compounds that can be helpful. So Dr. Chill, take us into supplements. Take us into what can they use for their patients.
This is actually the supplement that I gave to all of my chronic pain patients. Most of them, actually all of them, had the omega-6 ratio that was higher than their omega-3s. So what I did was, along with decreasing their omega-6 rich foods and increasing their omega-3 rich foods, I wanted to decrease their inflammation quicker for them and also improve their omega-6 to omega-3 ratios quicker for them. And a way to do that was to give them omega-3s. Now, a professional tip for you is, your patients may tell you they're taking a fish oil, right? When I first started, I trusted my patients. And sometimes they would not get better. And I was like, wait, you're taking fish oil. I don't get it. I would have them take a picture or bring in their fish oil that they were taking. And guess what? It was mostly omega-6s and omega-9s. And so now when my patient says, I'm taking fish oil, I say, snap me a picture of the label to ensure that it's only omega-3s. If it's only omega-3s, then they're good to go. Then what we could do at that point is give them the correct dosage that they want to take. And when you're looking at dosages, you want to look at giving them anywhere between 2 to 4 grams, right? There is a study that was completed, and this was a randomized double-blind trial on 50 adults ranging from 38 to 85 years old. They all had mild knee pain with osteoarthritis. What the study showed was that when they took 2,000 milligrams a day for a month, their symptoms and their pain decrease. It improved their pain, their stiffness in sleeping and standing positions, along with their range of motion. On there, if you want to read that study, it is called krill oil, which is an omega-3, improves mild knee joint pain, and this is a randomized controlled trial. But what I would typically do is I would typically start my patients on about 2 grams or 2,000 milligrams, those are equal, and then increase their dose to about 4 grams. And this is all dependent upon what I thought their omega-6s were. And this can be done through asking them or testing them, right? And if they showed to be tested with higher omega-6s, then I would increase their dose for them to get that omega-3 ratio down quicker for them. And omega-3s worked like a charm for these patients. They were extremely happy with the omega-3s. And my whole goal with omega-3s was not to keep them on those omega-3s forever. I wanted to do the omega-3s to get their ratios down. And once they maintained it, it might be a maintenance dose for a while, or it might be omega-3s as needed for them instead of taking their NSAIDs as they were before.
So now we have a second supplement that is really important. So there's 2 things we want to do with osteoarthritis. One is reduce inflammation, which we have multiple protocols and strategies on how to do it. With current research, we know certain herbal compounds and nutritional compounds can interfere and inhibit certain inflammatory pathway or inflammatory enzymes. So we can be much more precise when we're recommending supplement instead of just saying, oh, take this supplement and let's hope for the best, right? Beyond reducing inflammation, we also want to support the regeneration of the joint, right? So we're obviously not going to reverse back time, but we want to reduce the accelerated joint destruction. And if possible, also helps the body to rebuild a little bit. And in case you're asking yourself, can I rebuild a little bit? The question is, in some cases, yes, a little bit. And there are some studies that are showing it. And one of the compounds, nutritional compounds that are really kind of starring in the world of research for the last few years is glucosamine and chondroitin sulfide. And there's a lot of really, really good research that suggests that those compounds are more effective at helping osteoarthritis when are combined together. You'll see some supplements have one or the other, but combining both is more effective. It's showing to do two things. One, there are some interesting studies that are showing that it can, when taken for long term, can reduce inflammatory markers such as C-reactive protein. And also it can help through improving the microbiome, gut microbiome, to reduce inflammation. That's the second root cause that we talked about, right? So in case you're wondering, how does glucosamine chondroitin work? Then it also works by modulating the gut microbiome. Now, interestingly, there are some studies that were consuming glucosamine sulfate at 375 milligram with chondroitin sulfite 300 milligrams, and they did that about 3 to 4 times a day for 6 months. So that's the general consumption. This is from a study called Glucosamine as Treatment for Osteoarthritis, and it was published in Frontier in Pharmacology in 2022. And here's a two really important clinical considerations. One, glucosamine is beneficial when taken for the long term. So that's what we always tell patients, like, this does not work as an anti-inflammatory supplement within 2 to 3 months or 3 to 4 months. This is going to be taken 6 to 12 months at least, if not for some patients longer than that, to start seeing the benefit. The second consideration is they have to take a dose that is high enough. There are a few reports, and I will post one of them here, is that the effective daily dose of glucosamine sulfate is 1,500 milligram of glucosamine sulfate. And it was reported in 2 studies to be able to significantly reduce joint space narrowing when patients consume it with mild to moderate knee osteoarthritis. The effect, and this is really interesting, when those patients took 1,500 milligrams of glucosamine sulfate, the effect was also translated into 50% reduction in the incidence of osteoarthritis-related surgery of the knees during the 5-year period following the withdrawal from the treatment. So again, patients might not feel the difference right away, but the studies are showing us that it significantly reduces the accelerated rate of degeneration. So a product of consideration is the glucosamine and chondroitin by Thorne. Thorne is a professional grade supplement company. We're not affiliated with any specific supplement company. And then we've prepared, just in case you're seeing patients with osteoarthritis and they're struggling with a lot of pain, we've seen patients by using this following protocol and addressing the root cause. We've seen patients literally get out of a wheelchair within 6 to 8 months. Starting to walk. We've seen patients with swollen knees and their pain reduced by 80%. And I'm going to share this protocol with you because I want you to use it for your patients. Curcumin. Now, you might be thinking to yourself, Tal, that's not a big surprise. We know about curcumin and the impact on inflammation. But there's a trick to curcumin when it comes to osteoarthritis. There's 2 things that are really, really important. One is the quality. The second thing is the dosage. If the patient does not take sufficient amount of curcumin, it does not work as well. They will still struggle with pain. So How do we know what dosage is effective and safe? There is a particular study, high quality study, double blind, randomized, placebo controlled, with 367 patients with knee osteoarthritis. And this was published in the Journal of Clinical Intervention Aging in 2014. And what they did is one group received 1,200 milligrams a day of ibuprofen. The other group got 1,500 milligrams of curcumin for 4 weeks. They compared the results, and what they found is that 1,500 milligrams daily dosage of curcumin extract was as effective in reducing pain as the 1,200 milligrams of ibuprofen without the side effects that was reported in the ibuprofen group, treatment group. Here's another way to help significantly reduce inflammation, to relieve joint pain. And what I tell patients is I educate them about this particular study. We typically tell them this is what they use, this is the dosage, and this is how long they used it. But know that while they looked at 4 weeks, in most cases we would want to continue this probably to 2 to 3 or maybe 4 weeks even. And you got to monitor them every week. You got to monitor every month. You got to monitor them for improvement, right? And make sure that they're not interacting. They're not taking any prescription medication that might interact with that, right? Of course, we learn more about this in the advanced program. So reach out to us if you're interested in learning more about that. It's called The Effective and Safety of Curcumin Domestica Extract compared with ibuprofen in patients with knee osteoarthritis. You know about the 2 major causes of knee osteoarthritis. Remember, there are probably 3 or 4 more that we dive into, and each one of those we dive much more in depth in the modules of the advanced functional medicine. And now you have 3 different natural solutions for your patients to help them with knee osteoarthritis. So
yeah, now they just have the tools that they can just start with right away, right? And instead of just giving them the NSAID, let's just ask your patients a little bit more, get some more information for them. You know, what are they eating? Can we look at their inflammatory processes, right? Are they eating a lot of vegetable oil, such as canola oil, things along those lines? If they are, we can start giving them things like omega-3s. Or if they're in pain, as you were saying, you can give them a high dose of curcumin. And dosage is really important in all 3 of those supplements, right? Actually, in all supplements in functional medicine, it comes down to the form and the type of the supplement and then the dosage. So it's really important that you work with the pharmaceutical grade or the professional grade types of supplements. And we kind of get into more of that in the functional medicine program.
7 out of 10 adults are taking supplements. We know that because the supplement industry is massive. It's a multi-billion-dollar industry. We have to acknowledge that just telling patients, just throwing in just figure it out, or go to see a dietitian, or don't take supplements. Most patients if they keep struggling or they don't like the side effects of the prescription, what they'll typically do, and I found this over 20 years of asking my patients, why have you decided to take this supplement? I get the same answer. In most cases, it would be something like, I went home and I asked Dr. Google what I should take for my arthritis. And Dr. Google told me that I should take this and this. And I asked them, well, what does that do? And in a lot of cases, they'll tell me, well, it did nothing. And the problem with that, with self-prescribing patient, they probably haven't taken the right supplement, right? So we know that omega-3 works in a certain pathway by inhibiting certain pathway. Curcumin works by inhibiting certain other pathways. Boswellia, certain pathways, certain enzymes that it blocks. Ginger, other enzymes or other pathways, right? So we know when we really dive deep into nutritional and herbal medicine, there are certain pathways that it blocks. And with one patient, we want to give them this. With other patient, we want to give them that, right? And the second reason is they haven't taken the right dosage, right? Third, they have taken a very poor quality supplement. So we want our patients are professional grade. We don't want them spending or wasting their money on off-the-shelf brands that surveys have shown over and over again that sometimes what's on the label, it does not match what's in the pill, right? Or in the capsule. Not a good thing. So we want professional grade. And then fourth, because we have not addressed the root cause. If they keep struggling or developing complication or getting worse, we have not figured out what's driving that disease process. So that's why functional medicine is really great with doing that. So I really appreciate all of you for being here, from taking the time, learning, developing your skills, bringing new skills to your patients and your community. And I appreciate Dr. Chill for being here.
Always a pleasure.
I hope everybody will have a wonderful evening.